Welcome everyone to our Holistic Health Career Day events. We have two fine speakers, Dr. Marissa Sosky and Dr. Valerie Hobbs joining us today.
Dr. Marissa Sosky was an alumni of San Francisco State, which is so cool. So the first question we have today is, why did you choose this career path, Marissa?
I chose it actually in the class that you guys are in right now. So I love presenting to Ken's Human Nature and Global Perspectives class because it feels very full circle to me. I was sitting in a class, I think it was in 2009, and a naturopathic doctor came to present about what she did. And it was a light bulb aha moment, life-changing, trajectory-changing moment for me. Where I didn't even know that that was an option to go into this field of naturopathic medicine, and it was everything I wanted. I had no interest in being a doctor before that, and because the field of medicine didn't at the time, or the conventional perspective of medicine didn't resonate with me until I learned about naturopathic medicine and realized, wow, you can actually be a licensed doctor and practice in line with all of these things that I was learning about in holistic health, and kind of looking at not just physical health, but environmental health and cultural health, and how that all influences a person's individual health, and how naturopathic medicine takes that all into account and sees the person as a whole person, instead of, oh, if you're something wrong with your heart, you go to a cardiologist, and if there's something wrong with your foot, you go to the podiatrist, and kind of this siloing of the different parts of the body and not seeing the person as whole. So as soon as I learned about this medicine, and I just switched and never looked back, never regretted a single day.
What training is involved?
It requires a bachelor's degree in something. It doesn't have to be pre-med. It just has to be you do have to have a bachelor's degree. There are some pre-med classes that you have to have before, but a lot of people, I'd say the average age, at least when I started, was 28. So it was a lot of people coming back for a second degree or a second career. And so and then you just have to do kind of the pre-med prerequisite courses. But you can have a degree in philosophy for all they care. So that's like the prerequisites to getting into the program. And then the program is either 4 or 5 years, depending on what duration. I think there's 6 different schools in the United States, and they all have slightly different programs in terms of, whether they offer a 5-year program or not. But the school that I went to offered a 5-year program, and then you can go off and do residency. So there aren't enough residency programs available to require them, but they're highly encouraged, and certain insurance companies will require that you do a residency afterwards. So I did 1 year of residency. I'm kind of doing a pseudo 2-year, but mostly off on my own 2nd year with a little bit of oversight, but and then I'll be done. But that's something that I chose to do because I'm going into the world of oncology and cancer care. I wanted to make sure that I had some oversight and some more mentorship before I went off on my own.
And what would you say is unique about the work that you do?
I kind of touched on it at the beginning, but it's really about the paradigm, or the worldview of the medicine, contrasting to conventional medicine, because that's the most drastic contrast. Where I was talking about those silos. Naturopathic medicine really works to incorporate the whole person, mind, body, and spirit. And also then the modalities that we use are very different. So when the naturopath who came and spoke to my class back in 2009 shared this with me, this was really the earth-shattering moment. So we have a couple kind of guiding principles. These 6 principles are really what guide everything that I do in the way that I approach patients. And this is really unique to naturopathic medicine. Definitely a lot of the Eastern healing modalities incorporate a lot of this too. So it's not that naturopathic medicine is the only one who looks at it, but this is kind of how they define it. So first, harm, which is really, really key. I think a lot of times doctors say that and it's just lip service without actually thinking about, well, what is this treatment? Is it actually causing harm? Yes, there may be a benefit in the long run, but are we causing more harm than good ultimately? Then identifying and treating the cause. And this is really key difference than treating symptoms and putting Band-Aids on symptoms. Because if you don't treat the cause, it's like patching a ship just with duct tape. That crack is going to get bigger and get bigger and get bigger. You can put all the duct tape on you want, but it doesn't seal it. So we need to identify what the cause is of what's going on, and then cure and treat that. and kind of going in that is treating the whole person. So you may have, for example, elevated blood glucose. You may have elevated blood lipids. You may have elevated fat in your, cholesterol, all of these pieces. Now in Western medicine, okay, so you get a medication to treat the blood sugar, you get a medication to treat cholesterol. Instead of looking at, well, what's causing this? Well, maybe it's diet. Maybe the foods that you're eating aren't treating your body very well. Maybe it's a toxic exposure that's causing all these metabolic issues in your body. So just kind of tying these all together. And then really focusing on the healing power of nature. And this kind of goes in, so this is also called the nature. I'm messing it up because I'm live. But anyway, the healing power of nature is huge, and that this body has this, our bodies have this amazing wisdom to heal itself if we just got out of the way. And so often we get in the way with the foods we eat, the toxins in our environment, even the thoughts we think that are toxic get in the way of our own body's ability to heal itself. And so I really work with people on on reducing those ways that we get in the way of our own healing ability. And then doctor as teacher, kind of removing that hierarchy of doctor as expert and more doctor as teacher. And also it's kind of vice versa. So I learn so much from my patients, and I see them as active members of their healing process. And that all my treatment recommendations are just that, recommendations. They're in the driver's seat. They make the decisions on what they want to do and what they don't want to do. It's not you have to do this or I'm not going to work with you model. And then prevention, which is huge. And fortunately, in the conventional model has been getting more and more traction, but still, in my opinion, not enough. So really working on what can we do to prevent disease from even occurring. And then this therapeutic order of intervention, and it's kind of like lowest force intervention to highest force intervention. So the lowest force intervention is to establish the foundation for optimal health.
Yes, I'm tied up right now teaching a class.
Okay. So establishing the foundations for optimal health, and that's usually removing obstacles to cure. So that can be removing foods that are toxic to them. That can be, moving them into a safer relationship, as a toxic relationship can be an obstacle for optimal health. All those things, and then stimulating these self-healing mechanisms that I talked about here, and this healing power of nature. Restoring supporting and restoring weakened systems, so different organs, and using botanicals or homeopathy to really support the body. And then addressing physical alignment. So this would kind of fall in the category of chiropractic, kind of that physical adjustment. And we learn a form of that, and we don't call it chiropractic, but we call it something else. But it's similar to that, where you're addressing the actual structural abnormalities in the body and how that can help. And then we get to natural symptom control. So up here is really this conventional paradigm of symptom management and of suppressing symptoms. But look at all of this that we can do before we even get to suppressing symptoms. And then up here, we can suppress symptoms with natural things, whether it be herbs or supplements. And then we can use drugs to suppress symptoms. And then high force interventions, usually are surgery, chemotherapy, radiation, kind of those really, really heavy hitters. And so this triangle or this pyramid really informs how I approach a patient, and that I'm always going to focus on these bottom pieces, regardless of the patient, but also assessing, like, do they need a higher force intervention right now? Is it not that bad? And maybe we can just stay here. And the amazing thing about naturopathic medicine is so much can be healed with just this basic bottom foundation. And we don't even have to go up here. Even things that you think are very serious, usually even just these small things can have a huge, huge impact on somebody's health.
What changes do you see in your patients?
Mostly most generally, I see my patients get better. I see them, I have a couple, at least a few that are coming to mind, where one specifically, she is about 67 years old. She is in remission from colon cancer. And so she came to me after she had already gone through conventional treatment. She was in the clear, and she's like, I just want to make sure this never comes back. So we really focused on a lot of wellness stuff. And she said this is the best she's felt since she was 40 years old. And it's not true. I didn't come up with any of these therapies. I'm just a conduit. I'm just giving her information. This medicine really, really helps people feel better. I also have another patient who I was kind of treating for post-COVID symptoms. He had a lot of residual effects. He wasn't in an acute infection phase, but and same. He's like, wow, that it kind of took me out of this fog. And I felt better than before I had COVID. And it's just amazing. It blows my mind every day what the body can do with just the simplest things of literally getting out of the way of its own healing abilities. And then and then more specifically, like a lot of inflammation reduction. That's huge. I work with people a lot. GI health, the best poops they've had in a long time. It's taboo to talk about, but I talk about bowel movements with every single one of my patients. All better energy, all this stuff. It's incredible healing. But I would say mostly in general, people just feel better.
What are the future prospects for your field?
Most of the jobs that exist when you graduate from naturopathic school are you creating your own job. Small business, owning your own private practice. I think a lot of people come in with the misconception that they're going to graduate and just get hired somewhere. And those jobs exist, but they're few and far between. So this is a really great profession if you like working for yourself and you want to be an entrepreneur and you want to meld those two worlds. There definitely are hired jobs that exist, but there's not as many of them, and therefore they're more competitive. Now, I definitely see that changing over the next, 5, 10 plus years. There's going to be more, I think there's going to be more jobs available. And with that, kind of more specifically to answer your question, is that I see the world of natural medicine in general, not just naturopathic, but all natural and alternative medicines really gaining a lot of traction in the next 10 to 20 years, because people are continuing to be disappointed with the Western medical model, and they're not getting healed. They're just getting worse, kind of that symptom thing. The cracks are getting bigger. And I think we're going to see more and more conditions where Western medicine is going to fail. A lot more chronic conditions, infectious disease that doesn't respond to what we have currently. And this is really where natural medicine is going to flourish. So I really see that there's going to be a need for our medicine. I mean, there already is, but it's going to get bigger, whether or not that's recognized by the conventional system.
What's the best way to find a naturopathic doctor?
That's a great question. So there's a couple ways. There's the National Association of Naturopathic Physicians. They have a Find an ND. There's also California Association is also a good place to find it. You can search California Naturopathic Association. And then you can also just, kind of the old school, this is how I found an ND when I was back in school. You just Google naturopathic physician and see what comes up in your area.
How to set up your own practice and gain clients, and is it challenging? How does one begin to think about the business side of this once you're out of your education?
Yeah, I would say yes, it's a challenge. Nobody hands it to you. It depends. It's so variable. I would say if you're an extrovert, you're going to have a little bit easier time because you're already comfortable going out, getting your name out there, giving talks in the community, all that. And it's really just about getting your name out there and exposure and utilizing your networks. So for example, one of the main reasons I opened a practice in California was I know a lot of people in California. I don't live there. I probably won't ever live there again, but I come back every so often and I know a lot of people. So that was kind of my business mind going like, hey, I already have this network here. Let's utilize that. Now with technology, I don't even have to live there. I can do everything via telemedicine, which is awesome. Although I do still go back and see people in office. I have a brick and mortar that I do see people every so often. There's a lot of nuance to it. So there's different strategies about getting, building an email thread and building a social media following. Some people do it that way. Some people, I find though, the biggest way that you get clients or patients is by word of mouth. That seems to be the most reliable and fastest growing way. Is if you just start treating a couple people and then they tell their friends and then they tell their friends, those people are already bought in because they've already seen the benefit that you've given to their friends, and they're so excited to work with you before they even walk in the door versus somebody who just finds you online and is a little skeptical and isn't sure if you're going to help them. Like, just getting your name out there as in whatever way is comfortable to you, and I would say that resonates with you, because you have to be authentic in the process, otherwise people will see through it.
How does naturopathic medicine focus on mental health? What do they offer the mental health professions?
Oh yes, so much. So there's like a whole, so kind of like going back to that triangle, that hierarchy, right? There's so many different levels that we can intervene at. You know, most basic being diet, kind of going back to that, like there's so much more research coming out now about food and gut inflammation and its impact on our mental health, and how if you can just remove food intolerances, sometimes that clears it up. Obviously we have prescription, right? So those kind of two things are on the opposite ends of the spectrum, where we can also prescribe, you know, psych drugs. There's different supplements and amino acids that can help with certain things. And then a lot of mind-body medicine, you know, so meditation. I see Dr. Harvey's on here too. So meditation and breathing techniques, stress reduction techniques, all of these pieces. You know, I don't do quote therapy, but I do counseling. It's like a form of that, where, you know, I have experience of my own trauma and, you know, working with people in trauma. And so I've developed skills to kind of get people to think about those processes in a way that's maybe different than a talk therapist. And then integrating, I guess, homeopathy is also a really big thing. And homeopathy is kind of like its own tangent and rabbit hole, and controversial sometimes, but that can be really impactful for mental health. So really, I guess the sum of that is I have a huge toolbox to help with mental health, and it really just depends on the patient and who's sitting in front of me, what level they want intervention in, and how interested they are in taking action to improve their health. So I'd say one thing about naturopathic medicine is we ask a lot of our patients. It's true. You know, asking somebody to change their diet or to take some supplements or to breathe, you know, remember to breathe, it can feel like a lot. And especially somebody who doesn't have energy, you know, our culture is so geared towards a quick fix. And what I'm offering is not necessarily, sometimes it's a quick fix, but not necessarily, and it takes work. So meeting the patient where they're at is important. And if people just want a quick fix and they want to take a pill and they want to be done with it, totally respect that, and that's their choice. And if they don't want to do that and they want to go more natural alternative route, huge toolbox.
Any thoughts about using that toolbox toward oncology or cancer treatment? Clearly you focused on this. We'd be remiss not to get your input about this. There's a lot of cancer in our society.
Yeah. I actually went into the field of oncology because I felt like there were so few options being offered to patients, especially back in 2009 when I kind of got on this road. Surgery, chemo, and radiation just didn't seem like a lot of good options. Like all of them were pretty destructive. Did they lead to healing? Sometimes yes, but a lot of times no. And nobody was talking about diet. Nobody was talking about you know, supplements and herbs and all that. So all of those, I use all of my modalities with my cancer patients. Like, I think there's very few times where I don't use all of them, because cancer is kind of like this ultimate manifestation of disease. And I'm having a hard time like reining in my thoughts, because obviously this is my world, so I could go on about this for a long time, but especially with the mind-body stuff, I think that is an underrated and underlooked at aspect of cancer care. This is kind of an anthroposophic, which is a different field of medicine, but kind of informs my practice, is that cancer kind of manifests sometimes as a dissociation with ourself. Like this tumor is forming its own entity in our body. It is us, but it's also not us. And so it's this kind of like interesting interplay, and how that manifests in people's psyche, and how they, you know, it's not always I'm not saying people cause their cancer. I'm not trying to blame anybody for that. But that mind-body piece really plays in. And then we have also for cancer care in the alternative world, some higher force interventions, like IV therapy. So high dose vitamin C. If anybody's, this is again, like each of these could be rabbit hole conversations, but mistletoe therapy, which comes out of Europe, I use a lot of botanicals, a lot of supplements, a lot of high dose herbs, and then also really, really focusing on those foundations, because those foundations are really what gives the body fuel and vitality to heal.
If you were starting over as an undergrad student, how would you take on your education if you were thinking of becoming a naturopath?
I guess the only thing that I possibly would have done differently is maybe do a degree in something else that was in science, since I was going to go so deep into science. But it really helped that solid foundation back, in science. Because so I did an undergraduate in biology with a focus in human physiology, and then did the holistic health minor. Holistic health minor wouldn't have changed a thing. Love that. Like that really was everything. The biology piece really did set me up to have a better, easier time in my first couple years of medical school, because I had a solid foundation, and I could actually like tutor biochem instead of just struggling through it. And so that was helpful. I don't know that I would change anything. I'm also, that's kind of my worldview, is I don't know that I would change anything in my life. But like I said, I don't think it's necessary to do a biology undergraduate. It just, if you're planning on going right out of school, it makes it easier. But I would also say, if anyone's considering naturopathic medical school, take a year off, take a breather, enjoy life, because life, you will not have the energy to do those things when you're in medical school. So that's what I did. And I was one of the best decisions. I worked, I saved some money, I partied, I had a really good time. I enjoyed being a young person. And then I got serious. So I would recommend that too.
All right. So for my first question, how you came about your career path. So why did you choose this career, and what was your training involved?
Hi, everybody. I've been a practitioner in healthcare for over 40 years. So my first path was not to Chinese medicine. My first path was really about Western herbology. And I was in an undergrad botany class, and it was the 70s. And there was this woman in the class that sort of, she had really long hair. She wore a lot of skirts and Birkenstock sandals. And she suggested that the plants we were busy keying out could be used as medicines. And I thought, oh gosh, I'm hooked. I want to know more about that. And so I pursued my college career to know everything about in the woods. And I thought I would become a naturalist for the Park Service. And so I understood herbal medicine from a Western science background before I entered my first health career as a direct entry midwife. And that was what I became interested in first. And I did that for 16 years, and I delivered babies at home. I was part of that back to the land movement where we chopped wood and carried water and grew our own food and were self-sufficient. And I used a lot of herbs in my practice. And I was speaking to an acupuncturist from San Francisco, actually, who I had met, and I was talking about how sometimes the herbs really worked and sometimes they didn't. And she said to me that maybe I had the right herbs and the wrong medical theory. And I thought, oh my gosh, if I'm ever going to really understand herbal medicine, I'm going to have to study Chinese medicine. So I came to the practice of Chinese medicine to really understand the herbs that by then I had been walking in the woods and identifying and making my own tinctures and my own salves, and sort of doing life in a self-sufficient way. I wanted to know more about that. Well, I was completely delighted to be able to stick needles in people, and I'd been doing midwifery, so I wasn't a stranger to medical intervention. Along the way, I did a paramedic training. And what I found in the practice was, I guess I've always gravitated towards health and healing. And for me, at the time when I was coming up in choosing a career, I could imagine knowing everything that a physician knew, but I couldn't imagine doing the job. Because my idea of the job was to use tools that just didn't resonate with me. And but I'm grateful for them. I have no this is not going to be a conversation about Western versus acupuncture medicine, because I think it's all medicine and it's all medicine that works. But for me to be able to have a relationship with the tools I was going to use, then it seemed like Chinese medicine was the way to go. It is 4 years of schooling after having at least 3 years of college. It is a rigorous program. The practice of what we know as Chinese medicine seems a little steeped in language that is based from medical systems in Asia. And so the language is a little different than we would talk about in Western medicine. And the description of disorders is different, but it's very logical. And it's just like Dr. Sosky was talking about in terms of looking at the whole individual, being able to ask questions about their entire life, not just about the condition that they're seeing, that they're seeking treatment for. For instance, if people are coming in for migraines, we want to know if they have a preference for cold or hot drinks, if they, how they sleep at night, if they have odd taste in their mouth. We also talk a lot about the things that you excrete, and it's diagnostic for us. And so there's a different framework of diagnosis for Chinese medicine that takes a long time to learn. And then of course you have to practice with needles and understand the herbs. The basic pharmacopoeia that we learn from is over 400 herbs, and then they're all put together in herbal formulas. And there's, I don't know, 165 of those that are on the basic exams to enter practice. So it takes a while to integrate all that material along with the treatment modalities of using exercise and exercise breathing and Chinese medical nutrition and body movement therapies and acupuncture and Chinese herbs. You also have to learn the basics of Western pathology, physiology, pharmacology, clinical medicine, physical assessment, because we're not exactly primary care providers, because we are not able to in every state to order the lab work and the x-rays and to put somebody in the hospital if needed. But we are considered people that you can see without a physician's diagnosis or a prescription. So we see our own patients, and those patients can be in a variety of conditions that you have to be able to understand the Western science of their condition as well as the alternative medicine of their condition, because if they need a referral or they need some lab testing, we're fully capable of writing orders for lab tests. So in our profession currently, we are offering doctorate level degrees. And we also have master's level degrees. So we're in a little bit of a cusp in the country of how you enter the profession. Across the country, the master's level degree is what is considered the entry level degree. But now we, like many allied health professions, we've expanded our training to include doctorate level education.
But I think you actually answered most of my second question, but if you wanted to add anything on to what makes your work unique and what changes do you see in your clients?
When you're encountering somebody who is in a vulnerable state, what makes the practice of acupuncture and Chinese medicine unique is the ability to figure out for any individual how you can complement Western treatment, how you can provide an alternative to Western treatment, and how you can maintain the health of the system and provide some preventative and recovery kind of medicine. I treated at the 1999 Olympics. There is a branch of what we do is about sports acupuncture and performance. That is really awesome stuff. It is so cool for, it doesn't happen every time, but many times somebody comes in and they're in pain and you do what you do and they feel better. And sometimes they haven't felt better with anything else they've tried. And that is a good day in clinic. There are also descriptions of theory within Chinese medicine that embrace some of our most difficult conditions, autoimmune disorders. Given the current pandemic, I'm not going to say that Chinese medicine can cure COVID, so please hear me correctly. But some of the herbal substances are quite tested about their ability to limit growth of viruses and to respond to cytokine storms. So this language of Chinese medicine, you may be familiar with, that we're going to diagnose people according to yin and yang and 5 elements, but we actually see a lot of integration and a lot exploding knowledge of what our medicine does to change the physiology of the body that is moving our profession ahead rapidly.
And then my last question is, what are your future prospects in your field?
This is a good question because like other alternative medicines, it's not exactly like we're fully integrated into the US healthcare system. And the US healthcare system definitely gives preference to use an older term, sort of regular doctors and then allied health. We are legally licensed or registered in all states in the District of Columbia, except for 3. So in 3 states, we are not. So people certainly can get access to the care, but it's usually out of pocket and rarely paid by insurance. If it is paid by insurance, sometimes the insurance company will offer acupuncture as a service, but they won't pay the acupuncturist. They'll pay a medical doctor or a chiropractor. And so that's a problem. Last year, Medicare announced that they were going to start paying for the first time for acupuncture for low back pain. However, all the acupuncturists that can get paid under Medicare have to work under the supervision of a physician because acupuncturists are not paid by Medicare, but doctors are paid by Medicare. So I'm in a profession that grew out of obscurity in my lifetime and has now advanced to the point of it's just on the brink of being much more accepted. I would say that since functional MRIs were invented, that what has really happened in acupuncture is that we're able to create the tools in Western medicine that can measure what acupuncture actually does. And for instance, just the ability to pick up where the brain is more active when you insert an acupuncture needle. And the fact that in many cases, the areas of the brain that take up more oxygen or more blood flow when you put a needle in the foot, for instance, confirms some of the classic theories of how this thing we call qi circulates in the body as described 2,000 years ago. I mean, that's some remarkable stuff. That is sometimes the language of, imagine if you didn't know anything about hormones and you knew nothing about blood chemistry and you didn't have a microscope, but you had, but you lived in communities that were subject to diseases and sometimes plagues and epidemics. You might, certainly there have always been people who want to be healers, who look at experience, who experiment, who take writings from people who have come before and then expand on them themselves, and who apply what they know in order to heal disease. So if you didn't have that microscope or didn't know about blood chemistry, the language that you would use to describe what you do may seem not quite modern. And so some of the language that we use is well understood within our diagnostic paradigm. What we are finding out in the modern era is that when we say that something will clear a disease that we characterize by an environmental name like wind heat, ends up being a substance that's antiviral, antibacterial, antifungal, and a feverfuge. So it brings a fever down. Or if we put an acupuncture needle in a point that does that, it might increase the white blood cell count or T cell counts. So we're finding that what was characterized and written down about this medicine for generations is now being measured and confirmed in profound ways that legitimize it. So Western hospitals want us. And Western hospitals now have to provide non-pharmacological methods of pain relief as part of their accreditation. And one of those methods that is being shown as effective is acupuncture. So we have acupuncture studies in the ER. We have acupuncture studies in the physical, in outpatient clinics. We have acupuncture studies for a variety of musculoskeletal diseases. And we're seeing that acupuncture is actually effective. And as effective as the standard of care. So the outlook, honestly, even though we're not quite at the table, we are knocking on the door. Kaiser actually is one of the better employers for acupuncturists. And so I actually work for the Acupuncture College here in San Francisco, the American College of Traditional Chinese Medicine. And a lot of our graduates get jobs at Sutter and Kaiser. And the VA hospitals, we have many graduates who are actually the directors of acupuncture departments at VA hospitals. That is definitely happening. It's still a private practice world for the most part, but hiring people it's really exploded in the last 5 years. Another thing that we do that I should point out is that there were some acupuncturists in Portland who looked at the system of acupuncture care in private practice or even through insurance. And they came from a certain political viewpoint where they felt like the healthcare system was really broken and people would not be able to access it and afford it. And so they created something that is called community acupuncture. And their idea was that, that we didn't need to have a practitioner whose entire time for a half an hour or an hour was devoted to a patient for most repeat visits, and that the practitioner actually could treat people who were in a common area, even though they'd be separated so there's privacy and conversation, that people could actually come in one room, much like they viewed as being done in China. and that they could create the space itself as a space that heals trauma. And so this is the quietest revolution in healthcare that has ever been. And so throughout the United States, there is a system of community acupuncture that sees people on a sliding scale. So it's really affordable for people to go 2 and 3 times a week and to take a lot of responsibility for their own healthcare. And they also treat many more patients in a day. And so some of those acupuncturists, one of my graduates from about 10 years ago has done something like 26,000 treatments in those 10 years. It's pretty remarkable. There is the method of doing acupuncture for addiction was actually started by the Black Panther Party in the United States. The Black Panther Party went to Montreal at first in the early 70s. They formed a healthcare system. They took over the Bronx Hospital with the Young Lords, which is a Puerto Rican group. And they trained with physicians in Montreal and created the system that is now known as NADA, N-A-D-A, which is a National Association for Detox Acupuncture, which is acupuncture in the ear that stimulates the brain, that has been shown to help people with addictions. And they provided this service in their neighborhood because of the heroin use in the 70s. So some of the earliest acupuncture that happened in the United States outside of Asian communities, where it has of course always existed, was founded by the Black Panther Party, along with this idea that you treat everybody in a common room. So we have a lot in America. There has been certainly many of our colleges teach a system of Chinese medicine that came from China, and some of our colleges teach a system of Chinese medicine that was popularized by a man named J.R. Worsley, who was English. And then there are this infusion of global and community-based acupuncture that is kind of unique in the world from the USA.
Well, it's just such a great pleasure to have you with us. I mean, I look at your past, it sort of takes my breath. I mean, you all those years as a midwife, practicing midwife, and now one of your specialty areas is really traditional Chinese medicine gynecology, and which I'd love to hear about it if you get a minute. But also having been a paramedic in a rural ambulance service for years, and you know, giving acupuncture at Pro Beach volleyball events,
Yes.
and now being the current director of the American College, clinical director of current American College of Traditional Chinese Medicine. You've been around the block.
I'm old.
Well, some people get old, they don't have such experience. So it's such a treat to have you with us. And one of your graduating students will be actually joining a panel with us tonight.
Yes. And he's so wonderful. Don't miss this, because this guy, he's going to go places. He's really awesome.
He's great. He wants to take acupuncture to the Native American communities in the Southwest.
Yes.
And one of the great things about acupuncture is it's so affordable. I mean, you can really be the barefoot doctor and go in and give treatments that are energetic and life-changing. So any final thoughts you have to share with us around?
I did give you my email address, and maybe I can do 1 or 2 questions. I know we're right up against your end time.
That's okay. Are there any burning questions out there you'd like to ask Dr. Hobbs about? One thing, maybe while someone's gathering a question or two, what is the length of time to be trained to become a practicing acupuncturist?
After undergrad college, it's a 4-year program that is really intense. It is a lot of hours.
Okay, so 4 years.
Yeah.
And when you finish, are you a doctor of Oriental medicine, or are you a, what is your title?
Yeah. And actually, we're really trying to get rid of that O word.
Okay, yes.
And we are definitely on the cusp of, you know, it had its utility at one time, but we got to recognize that in some communities, it's not a word that we're going to carry on into the future.
Right.
So we're using the term acupuncture medicine to describe what we do. We do more than just acupuncture. We do have herbs. Remind me of your question. I got all distracted about the
That's okay.
word.
Just wonder what does a student have when they finish with a degree in acupuncture in 4 years?
This is the weirdest thing in the world, and it's a thing about development of a profession where, you know, the professionals, particularly people who were trained in Asia, kept saying you don't have enough hours in your education. You need to be able to do more and more. And so for a while, when there weren't a lot of books in print, we were at a master's level degree. And as things developed, we went to a doctorate degree, but the years are no different. 4 years master's, 4 years doctorate, either way. But yes, they are nationally accredited doctorate degrees, and just like other allied health professions have reached doctorate levels.
And you can practice in most states of the union.
Yes, there are 3 states that don't have an acupuncture law currently.
Okay, wonderful. Looks like we do have one closing question. Are there any Chinese medicine practitioners that have inspired your journey, and who do you really admire?
Miriam Lee.
Hmm.
Miriam Lee is the late Miriam Lee was a Santa Cruz practitioner. She was an OBGYN in China who then, when she moved here, became an acupuncturist. Miriam Lee was the reason that acupuncture became legal in the state of California, because they tried to put her in jail. And when it came to court, so many people that she had helped filled the courtroom and around the block. That Reagan actually developed a pilot program for the licensure of acupuncturists. And there are so many wonderful heroes. I've had such exciting practitioners where I'm sitting at over 60 years of age in a continuing education seminar, and they still change my life, where I have that aha moment. Now I understand something. And that has happened, that I've encountered many people along the way, just like that.
Well, Dr. Hobbs, thank you very much for joining us and bringing your wisdom and all your years of thought and perspective. Thanks again very much.